The topics discussed and the information provided on this program is for general information. The hosts of this show are not medical professionals and are expressing their personal views and stories related to their individual lives. Their views are not intended to be used or taken as medical information. If you or a family member have suffered a traumatic brain injury, you should seek help from a practicing licensed physician.
Whitaker. Welcome to Brain Mechanics. It's a show that I'm with here, Malin Whitaker, and our host, Matthew Duffin. And what we're here to talk about is traumatic brain injury, stroke, recovery from same. When Matt and I are talking, keep in mind that they're just opinions because we're neither doctors nor nutritionists nor specialists of any kind. And what we have is opinions. But we have guests who are real people and are involved and work in subjects like this. Today we have Julie and Tiffany from Rosebud Village, and they are going to talk to us about the kind of services that are available when something like this happens to one of your own. Might be an accident, injury, or whatever, but welcome to Brain Mechanics. Matthew.
I'll be the brain mechanic today.
Yes, sir.
Hi.
Hi.
Hi. I lived at Rosebud Village twice. I've lived there a long time. And, you know, these are the things that happen when you have brain injuries and other injuries, you know. Well, first of all, don't let me, we're going to talk about, but they have a dementia ward because if you're going to live long enough with your brain injury, you're going to go into dementia. Just the way it is. Sorry. I'm a hardcore advocate, but it's the way it is. Live it while you got it. And they're a rehab facility, skilled nursing. It's a rehab facility from hospital to home. They got some therapists that work really good. They think they're cute. I think they're pretty. Oh, I'm not supposed to say all that about them, am I? No, we have a really good programs over there. A lot of skilled programs you can do for your own personal rehab throughout the day. It's an extended care facility. They have a dementia care facility. You know, they're all separated. They got some great people. Dr. On is there every day, hands-on. Julie's there every day, hands-on. Now she's a director of marketing and admissions is Tiffany, and she's there most of the time. A lot of times she's out on the road, you know, she'll come right, you know, if you're going to go in, she's going to come right to your house, interview you, talk to you, make you feel welcome. At least she did me. My dad. I mean, that's why I went there. They brought me out of it twice, broken hips twice. My gosh, the first time I was there, I went there for a broken hip. I think 3 weeks into it, maybe 4, my dad died. These people were just outstanding to me. It was like family. I didn't know any, I mean, everybody. And I'm talking about the professionals. My dad was my best friend. 2 weeks after that, my right leg started acting like my left leg and it went out. So I had to have more vascular surgery. And there was something else that happened too. I don't remember. It was like I was there like 4.5 months, extended care. I was able to have a private room. They have private rooms. There's some where you couple up, you double up, and that depends on how long and what you're doing and what takes care of there, I assume. But anyway, they made me feel so comfortable through the most dramatic, and I've been to war too. You know, it was pretty traumatic and dramatic when this happened, week after week after week. I remember just being in my wheelchair, walking down laughing with people saying, well, wonder what's going to happen next week. So far, we got this week to take care of what happened last week. And they were great. And Tiffany, I thank you so much for assuring she would fix my computer, kind of. She got my phone running. They take care of you there. And it's right here in Richmond, Indiana. As many places are extended care for this, but I chose Rosebud, and I chose it again, and I would choose it again. And it has nothing to do with me being on a billboard. Just wonderful visits and places to be when you don't want to be there. You know? Face facts. Who wants to be in a home? You got to be able to move around. You got to be able to take care of yourself, or you're going to be there. And I know, I'll start with Tiffany. Where does a standard call, basic, I know you go out and you don't recruit people. You go out and you have people called, or you find, or from the hospital, or I assume Area 9 or home care companies that can't do it no more. This person's out.
Mm-hmm.
So okay, I found them for you. So now what are you going to do with me?
Yeah. And that's what we do, the home visit if you're at home, or if you're at the hospital, we visit at the hospital. You know, we do our assessment to make sure that you meet the need of a skilled nursing facility. And then after that, it's all paperwork. You know, we get all the information we need to take care of you there. And then, like I say, it's an easy flowing process. It's nothing that the patient has to do. We do everything on our end. We go through Area 9 through all of our patients. They're the one that does pretty much the assessing when it comes to how long you can be in a skilled nursing facility, that kind of thing. And we bring you in, rehab you home. I mean, it's fairly simple.
So you would have a goal after Area 9 would tell, well, Matt can only be there for 5 weeks. Matt can be there for 4 months. Matt can be there for a year. You're going to have to tell him he's going to have to double up in another room. He can't be by himself that long. And I like my own room. I had it decorated up, baby.
Yes, you did. Yes, you did. You made it home, which is good. That's what we want. But yeah, Area 9 normally just by, a lot of times they'll come out and see you, or looking at your documentation that you have. They're the one that determines how long they think it takes you to recover. There are certain criteria that you have to meet to stay in a skilled nursing facility for ever, or or more than 6 months, that kind of thing. So they're the one that kind of monitors everything through the state.
Area 9.
Area 9, yeah.
So once Area 9 gives you somebody and you say okay, and everybody's in, and they put them in a little room, and they start bringing in their clothes from outside and all that.
Mm-hmm.
Dr. Ahn would see them, and they would turn them over to Julie in her offices, right?
Well, I kind of start before that. I'm the person that does all the hiring and training of staff and making sure that we have quality people at the bedside taking care of people like you that come in, to make sure that we're given the very best care possible. We have an interdisciplinary team of therapy, admissions, nursing, that really makes sure that we're addressing every need while the resident's there.
Yeah.
Well, no, my care was always outstanding. Everybody was always friendly.
Yeah. I'm glad we could be part of that success story for you.
Well, thank you. Yeah, it's
Well,
all
you
good.
did the hard work.
Yeah.
You did the hard work
Yeah.
as well. It takes the patient also doing the therapy and, really working hard. But it also takes great skilled nursing, it takes great
Sure.
physical therapy. It's really just a team working with the patient to make sure that we have a good outcome.
It takes a patient's drive.
It
I'm not going
does.
to, you
It
know,
really
it
does.
simply takes, and I'm bragging, I'm not patting myself on the back. I've been through it a long time, as Malin well knows. And with his wife, she's always wanted to get better through him, you know, through their programs, through what they do. She believed in it, believes in it. So it's always up to the individual, because a lot of guys are going to turn their head over on the pillow and go back to sleep, and they're good. You know, it's sad, because they've been there where you was talking earlier about when you cross over.
We also have a very good social worker. Social services gets involved and can assist in that kind of thing and helping to motivate residents as well.
We have outside services as well that can come in and help with that, you know, if they're, and like in your situation, you know, you had a lot of going on in your life at that point in time that would cause some depression, you know, just kind of the withdrawal, which I know it's not normal for
If I
you to
wouldn't have
withdraw,
had a brain
but
injury, I don't know if I would have made it.
yeah, you know, so we have outside services, you know, counseling. We have nurse practitioner that can come in and talk with you, you know, if there's some medications that might kind of help with your depression, that kind of thing. You know, so I mean, all aspects, you know, that we will treat you in every which direction to make sure you're successful to get home.
And in the right spot. You know, like I say, you're divided up into 3 or 4 different groupings of,
Right.
and everybody's on a hall.
Yeah.
Most of the nurses I've seen are familiar with the patients and their problems. They work the same halls
Right.
a lot.
Continuity of
We
care.
try to do that for continuity of care.
Yeah.
Yeah,
But
that's-
all of our staff are trained in all the different disciplines so that we can make sure that we're adequately staffed at all times. So.
Well, because when you're dealing with all the people that you do with brain injuries, we're out there, man. We're not always there all day long. You know, sometimes I like going down and watching the birds. Big deal. I love going to, I called it junior high art class, but you know, the
Activities.
activities was great,
Yeah.
you know.
And that's a fun time, but that's also very helpful in as far as therapy-wise to help reconnect some of those skills and brain processes. That's real
Well,
important.
to me it was great because I didn't always like bothering people one-on-one too long, except her. But, you know, I could work with people in there as we're making things.
Right.
You know, joke around, plus, you know, that's kind of like Coach Little League. You know, I'm going to joke around, but we're going to take it serious too. We're going to find the serious in there. That's how my dad taught me. I don't know if you've ever had any experience with.
No, with obviously for those who've watched previous shows, you know, I'm in a position of being a caregiver, and in my case, my wife had a traumatic brain injury, and it's extraordinarily demanding. And I think it is your facility, from what I've seen with Matthew and another gentleman who has spent some time in there, a couple of church members and that sort of stuff. It seems like the care is very, very strong, very good. But from the point of view of helping relieve the caregiver, because we're going to finally, you know, time's going to run out, they got to get out. Are you directed toward that as well, as in helping the caregiver understand what is going on with the patient and what needs to be, or I don't know whether we call them patients, I don't know what we call
Residents,
them. Residents,
yeah.
okay. But to help them transition over as well. It's not just like, okay, here's the door.
Oh, no. I think the staff, the nursing staff, are very good at recognizing the family's needs as well. If they're going to go home with a certain kind of therapy, then that training can occur before they leave, and then they can do some return demonstrations to make sure that families are really comfortable before they walk out the door.
Good.
As far as physical therapy goes, they're between PT, OT, and speech therapy. They're evaluated while they're in Rosebud, but they're also looking at how can we best transition them from our building to home. What kind of devices are they going to need equipment-wise when they go home? Are they going to need, Meals on Wheels? Are they going to need Area 9? Are they going to need like a home health care to be involved as well. And I think all of that is identified ahead of time before
So
they
you're
leave.
able to help the
Absolutely,
people know.
absolutely.
Great.
And the resident too, you know, what are they going to need to have the best quality of life and to be able to get them home and functioning in the highest capacity possible. So looking at what we call ADLs, or activities of daily living,
Okay.
training our resident as best we can, you know, how to bathe themselves, dress themselves, how are they going to be able to cook a meal for themselves once they get home. So those are all kinds of things that can take place with our occupational therapists before they leave the building. You know, physical therapy, we're looking at strengthening, we're looking at a home assessment. Just, you know, what do we need to tell them now before they leave our building that's going to help them be successful at home. We don't want them at home floundering around, not knowing what resources are out there, not knowing the skills they need. So we try really hard to make
So
sure
that's
that
part of
it
your
is
assessment and
very,
discharge.
very much a part of that. And that's
cool.
too where that interdisciplinary team comes in. We have nurses, we have social work,
Okay.
you know, we have the physical therapy staff, and we meet daily to try to figure out, you know, what care is still needed and what education might be needed, what resources are needed still.
I know some people might find themselves either they're just not of means, or they don't, you know, have the kind of insurance or whatever to cover this type of thing. Are you able to help identify sources for them as far as that additional care or care in your facility?
We try really hard to do that.
Yes. Well, we have a business office manager,
Okay.
and that's what we do. And a lot of times she meets with the family as well. What we call a road to recovery meeting. It's usually within the first 3 days.
Okay.
You know, and they can talk about that from the very beginning. You know, so that's what our resource is for her, is to help you if there's like a Medicaid pending. You know, to see if you're
Right.
qualified for any other services.
I think
that'll
it's
help.
one of the most frightening things these days is like, you know, what do I do now? You know, I mean, you're already in an emotional state
Right.
because it's one of your loved ones or something's happened to them.
Yeah.
And
Well-
now you got to answer all these questions.
I think
Yeah.
that, because usually the first two questions are going to be, how am I going to fix this? How much is it going to cost? Sometimes
Right.
it is, what's it going to cost for me to fix this?
Yeah.
I'm not going to get into any of the
No, but
insurances or none of the
Right.
Obamacares or none of that. I'm just, you
Well,
know.
I think it's good that you've got
people
a
need
professional.
repaired. Right.
You got a professional team here that knows what they're doing and has obviously recommendations. And as I said, Matt and some people that I've known personally that have been there, and I'm hearing good things. So that's tough to do in your business, because a lot of times, no matter the good things you do, things don't get better.
Yeah. Yeah.
Oh, if you need to see a doctor on somewhere, usually throughout the day.
Physician.
So if you
on-
need
on-
to see him, you can
Yes.
get in your wheelchair and, you know, have somebody you'll find him. One of the nursing, or, you know,
I can picture you doing this.
I did it all the time.
Yeah.
I was busy when I was over there, wasn't I?
Yes, he was.
He does daily visits, but he's also available. The staff can call him, and
Right.
when people are admitted in
Well, he
in
did
the
mo-
evening hours, he's available. He comes in, and so he's very attentive to the residents.
I would interrupt him, we'll just say occasionally. And he would always answer my questions.
Yeah, he's wonderful.
Yeah. Well, he knows you as a person. You're not just a patient or a resident. You know, he knows every single one of our patients, what's
Right.
wrong with them. You know, again, very attentive to all of our residents, you know, and knows them as a person, you know.
That's what I'm saying. The first time I was there, when all that was going on, he took that to himself personally. I could see it. I could see all that in a lot of people's eyes. I mean, you know, some of them, life is life, but you know.
Right. Yeah. Caring and compassion, that's what it takes to be a good building, and Rosebud does have that. You know, it's the compassion.
Well, Julie or Tiffany, is there a particular area? Obviously, we're kind of focused on the brain injury or a traumatic brain injury, stroke, things going on up here. Are there some areas that you'd like to cover that we're not familiar with? Obviously, we know why Matt was there,
I'm gonna get into dementia.
and I think that there's some of these others that maybe you might want to touch upon so people know what services you have. It's just not about TBI.
No, I mean, and we take care I mean, a lot of different complexities when it comes to diagnoses. You know, right now we have a wound care nurse,
wow.
so we've been really focusing on wounds, strokes, ortho with hips, knees, pneumonia, IV therapy, just weak and debilitated. You know, you don't really specifically have to have a diagnosis of pneumonia or anything like that to come in and have rehab. And with our dementia unit too, you know, we do a lot of focusing on that as well, you know, to have that 24-hour care. We can handle just about any kind of diagnosis, you know.
I will say we work real closely with the wound center, and we've had some pretty tremendous success stories with wounds.
Absolutely.
And so that's an area that I think we can really help the community
Like a
with.
therapist that come now for wounds, or
Well, from what I understand, wounds that don't heal are
They're very
used
complex.
to be uncommon,
It's very
and
complex.
now it's like
yeah.
you know, it's happening a lot. So
Right.
this is a special area that you have as well.
It's we've had some pretty great success with
Good.
that.
Absolutely.
so I could have just stayed there after.
No, they would have sent you home no matter what at some
Yeah.
point, Matt.
Yeah.
After that one surgery, you've seen some of the wounds that came from that surgery. It just happened. It was an infection.
Right.
And
Yeah.
I had to go 3-4 times a week and have them put this big Martian-like squirt gun.
Yeah.
Looked like on a Bugs Bunny cartoon, big, you know, to have it cleaned out.
Yeah. Yeah.
So you
that's-
guys could have just now.
And yes, our therapy department actually can do a lot of our wound care as well. We don't do, you're talking about more like a pulse lavage, which the wound center does. Ours is very similar to that. It is called MIST. It's a MIST therapy, which is, it's the same type of technique. It's just not as, it's more a little, what to say, it decreases the infection type of thing, risks,
The
you know.
wound center ended up sending me back to Reed outpatient therapy. I'd worked all my life for 6
Yeah.
years now.
Yeah.
Yeah, you know, and one of the therapists there knew how to do it, but that's why I was wondering if you guys have that
Yep.
ability now.
Yeah, that's,
Well, let me get another wound. I'll just come over and hang out with
No,
you.
no, don't do that.
You're supposed to do TV now.
yeah.
yeah. Later on down the road, you can come visit us again.
You still going to be there later on down the road?
I would hope so.
Okay.
I'm young.
Yes, you are.
Yeah. So I plan
So
on
am I.
being there. Yeah. So that's what I'm saying. You know.
TV star too.
Yeah.
We've been talking about taking care of residents, and
Yes.
another thing I think we do really well is I think we take really good care of our staff. And I
Yes.
think that's important as well, to be if you have a person in a caregiver role like our staff, it's nice to feel appreciated, and it's nice to have people in the building that value you and really take care of staff. And so I think we do a pretty good job of that.
But it sounds like you seek out what I would call trained professionals or professionals for the
Try
position.
really hard. Yes, I really do. I want the cream of the crop. I want the top skilled people to come and work for us, so that we do have those success stories like Matt. You know, we want to have good clinicians.
Well, sometimes you hear about other facilities. I mean, and this is a number of years ago, my grandmother wound up in a nursing home, and you know, it was one of those things where like, no, let me take her out of here again, you know, with kind of experience. And I have not detected any of that type of feeling when I have visited with Matt when he was in, and as I said, there's a couple of other people from our church that have been there, and very professional, very focused, that sort of thing. And I think that level of comfort when you walk out those front doors is critical, because you're leaving your loved one behind.
Right.
And that's neat. I'm glad you're shooting for that. That's neat. Like I said,
All the way through, you feel so good from the, I don't know, CNAs, whatever they call them, all the way up to their nursing, you know, their nurse who's always right there. You know, the therapy department is a huge room.
Yeah.
And they got 4 different types of therapy, I suppose, in there: speech, OT, PT.
Speech, OT, and PT. And
Yeah.
Great. I mean,
Are there any other feature? Something's happened, you're getting discharged from the hospital or that sort of thing. When do we, as we're out there, the relatives or whatever, when do we contact Rosebud? How do we go about it? I mean, we just...
Anytime, like even if you're in the hospital, they have discharge planners that are, social workers that kind of help you with your discharge. At that time, they can say, well, you need to go to a skilled nursing facility for rehab, where they'll give you all those options of where you'd like to go. And you just say, I want to go to Rosebud Village, you know. Or, like, say you get home and, excuse me, she's struggling, and you think, oh, I can't do this, I can't take care of her. Then you call us then. So it doesn't really matter what scenario you're in. I mean, we can
So
help.
it doesn't have to be right out of the hospital.
Absolutely
it could be,
not.
You're just struggling at home with some.
Yeah.
Okay.
It could even be a respite type situation where you're trying really diligently to keep your loved one at home, and we can be called upon to provide a temporary relief for you.
Okay. But from the point of view of a caregiver, I can tell you that it's, there's times when you go,
Yes,
You guys are all
I
tied
agree.
in with what, American Senior Communities?
Yes.
Yeah, we are.
And like the Heritage House, I believe, in
Of Connorsville.
Connorsville.
Yeah.
That's where the great Joni Goins works. She's one heck of a speech
Joni.
therapist.
Yeah.
American Senior Communities owns about 75 or so facilities in the state of Indiana, and we are one of them. Our sister company in Connorsville, and then Stonebrook is in Newcastle.
Newcastle.
Those are kind of the closest ones to us, but
Yeah.
Anything else I'm not touching on real quick? We're running short of time, and I don't want to leave anything out. You're so kind to come over. And I'll screw up your day if nothing else, just because I can. I
Touched
know
on
you had a
all the
lot of
bases.
notes, honey. Did you?
oh no, I'm good. I'm a doodler. I
Oh, okay.
doodle.
Yeah.
Okay.
People that know me know that.
And your
My
artwork is
notes
for
are
sale
real.
where?
I have no artwork. No. The only other thing I had thought about with we were talking about traumatic brain injury. I think I would be remiss if I didn't say prevention is always the best. For
I'm a true nurse.
I'm a true nurse,
Yeah.
right? Always teaching prevention is the best, especially when you're talking about childhood age. Wear your helmets. Follow safety instructions off of when four-wheeling, and make sure you're using safety precautions when you're sledding or diving and those sort of things. Wear your seatbelt as an adult,
Yes.
for car wrecks, and always, prevention is always the best thing.
Sure. Even after you get a traumatic brain injury.
For sure.
I mean, that last trip to the hospital, I broke my hip.
Yeah.
Everybody knew that. Well, I banged my head around 4 or 5 times.
Yeah.
Nobody really, since the CAT scan showed no blood problem, nobody really realized that it's going to make him goofy for a couple of months again.
Yeah.
And that's what I was talking with you
Yeah.
about. But
Well, we're nearing the end of the show. Julie, Tiffany, thank you for being here. We have your information. I believe it'll be up here on the credits at the end of the show. If someone does need to get hold of Rosebud Village, I hope that you'll take advantage of a local good facility. And what we want you to know here as things go along in life, that there is hope. There are people out there to help you, and I hope you'll take advantage of it. Thanks for being with us on Brain Mechanics. Take care. Be safe.
The topics discussed and the information provided on this program is for general information. The hosts of this show are not medical professionals and are expressing their personal views and stories related to their individual lives. Their views are not intended to be used or taken as medical information. If you or a family member have suffered a traumatic brain injury, you should seek help from a practicing licensed physician.